Okay, Bismillahirrahmanirrahim. Once again, welcome to my new lecture. Dear viewers, today we will talk about the aminoglycosides. So, what are aminoglycosides? Aminoglycosides are broad spectrum antibiotics. So, broad spectrum antibiotics, that is also called bactericidals. Actually, so these aminoglycosides, these are the group of antibiotic which are not only responsible to stop the bacterial growth, but it can kill the wide range of microorganisms. Clinical indications of aminoglycosides. These group of antibiotics, so they are used in the variety of infection like endocarditis, pneumonia, meningitis, septicemia, and many more infections. The mode of action or mechanism of action of aminoglycosides, it can inhibit or stop the bacterial protein synthesis. So, in simple words, these aminoglycosides are also called protein synthesis inhibitors. These group of antibiotics, especially the aminoglycoside, they are not safe in pregnancy. It cannot be used during pregnancy. There are certain complications which are related with this group of antibiotics. So after use of these drugs, there are some toxic reactions or ADR, adverse drug reactions, which are reported by these agents. So aminoglycosides, they are not safe in pregnancies. Aminoglycosides include gentamicin, amikacins, streptomycin, neomycin, and tobramycin. So all these drugs, antibiotic, belong to aminoglycosides. Okay, now come toward the side effects which are reported after administration of aminoglycosides, which may cause nephrotoxicity, which is the major side effect of the aminoglycosides. Nephrotoxicity means blood urea, nitrogens, and serum creatinine levels. Toxicity of the kidney. Ototoxicity, that is called dizziness, tinnitus, loss of balance, hearing loss, and neuromuscular toxicity, the muscle tremor or twitching, so it decreases the muscle strength. Aminoglycosides can be administered through different routes. So it can be administered through intramuscular, IV, so especially the polar compounds which are not absorbed by taking orally. So there are some drugs which cannot be absorbed through different routes like IM and IV, so then it can be taken orally. Come toward the nursing cares. The nurse is responsible to administer gentamicin cautiously in clients with impaired renal function, reduced hearing, dehydration, and neuromuscular disorders. The nurse is also responsible to monitor for dizziness and ringing in the ears. It means that he and she is responsible to monitor all these conditions like monitoring of the hearing and balance. So the nurse is also responsible to monitor the renal function test, RFTs, and intake output, especially the serum creatinine and blood urea nitrogen. It should be checked properly. So let's suppose if the patient kidneys, they are not properly doing work. So then you can check all the parameters, then you can adjust, then you can give or administer the drug according to the condition of the patients. Adequate hydration is vital. These are the antibiotics nursing implications. So before breaking therapy, assess drug allergies, hepatic, renal, and cardiac functions in lab studies obtained through patient's health history and, for example, immune status, especially in case of recurrent infections. Assess for the contraindications and antibiotics used in potential drug-drug interaction, which I have already mentioned in my previous lecture, that the nurse is responsible for each and everything, especially because he is directly involved in patient counselings. So that's why all the terms, all the conditions, all the physiological conditions should be checked and monitored. So after that, you can administer any kind of antibiotics. It is also very essential to obtain the culture from appropriate site before beginning antibiotic therapy. Instruction should be given to the patient to take antibiotic exactly as prescribed for the specified length of times. For safety reasons, check the name and as well as the medication carefully since there are many agents that sound like similar mean spellings. First of all, you will have also to take all these things and observations, that you should check the spellings of the medications and many more. Okay, now come toward the main summary, the abstract of the common antibiotics. So let's see here. These are antibiotic and its simple mechanism and target bacteria. For example, penicillin. So penicillin is also called beta-lactam antibiotic. So these are also known as, it can inhibit the cell wall synthesis. So that is called cell wall synthesis inhibitors. And penicillin can target the gram-positive bacteria. Ampicillin is also called, it can inhibit cell wall synthesis, but this is broad spectrums. You can say it can target the gram-negative bacteria. While cephalosporin is also called cell wall synthesis inhibitor, so it can target the gram-positive bacteria. Tetracyclines is another group of antibiotics which are also called protein synthesis inhibitors. So it can inhibit protein synthesis and that particular species, which is bactericidal in nature. While streptomycin, it can inhibit the protein synthesis, which is also called protein synthesis inhibitors, and it can target the gram-negative bacteria and tuberculosis. Quinolones, which is another group of antibiotics, so they are also called DNA synthesis inhibitor, which we have already explained in detail in my previous lectures. So they are used in the treatment of urinary tract infections. There are also certain microorganisms, bacteria, which are involved, which can produce certain complications in your urinary tract. Another one is bacillocin. So bacillocins are also called, it can inhibit the cell wall synthesis, and they can target the gram-positive bacteria. So these bacillocin can be also used in the form of ointment, and they can be directly applied on the skin. Rifampicin is another antibiotic which are also called, it can inhibit the RNA, ribonucleic acid. It can inhibit the RNA synthesis, and it can target both the gram-positive bacteria and gram-negative bacteria. This is the reference which I have taken from different type of research articles. So antibiotic NHS. So you can also check it online, especially on Google Scholar. Once again, so thank you so much, my dear students, for watching my lectures. wish you all the best, and if you have any questions regarding my lectures and if you need any kind of help or material, so I'm always available for your services. Thank you so much.